here for Total Health Television and Total Health Magazine. We are on location in sunny San Diego at the Hilton Spa and Resort in Mission Bay. And I'm talking today with two wonderful ladies who are with an organization that you just have to learn all about. So we're going to start right now. We're here because of the Health Symposium.
Environmental Health Symposium.
Environmental Health Symposium, which is even more important. And it's interesting for me personally a lot because I just watched Racing Extinction.
Oh.
Yes, and literally brought me to tears.
Yes, me too.
So these are all topics that we have to talk about. I mean, it would be nice if the mainstream media would do more of this, but it's up to us, I guess, so let's do it.
Yeah.
So how did you get involved with the symposium?
Well, this is a collaboration of 3 different groups. We've been working in the area of environmental health as physicians for a long, long time. For myself, about 15 years. For our other partner, about 35 years. And so we put on conferences on environmental medicine for doctors. Okay. And we're now collaborating with Cheryl, who's done the Seeds of Doubt conference in the past.
Okay, Seeds of Doubt, that must have been great.
Seeds of Doubt, yes, it was. It was a conference looking at the detrimental effects of GMOs and glyphosate from a practitioner and public health standpoint.
Right. Well, and we're looking forward to interviewing Professor Seralini, who's also going to be here at the conference.
True.
I understand it's his first time in North America?
His first time speaking publicly in the United States.
Okay. And Professor Stephanie Seneff is also here.
Stephanie
Correct.
Seneff will be
Some
there.
big names. I mean, these are like A-listers.
Senior research fellow at MIT who has published extensively on glyphosate and Roundup and the toxicity of that particular ingredient in Roundup.
And there's a lot of research that's coming out now from different countries. Much as Monsanto and others have tried to suppress it, there is actually a lot of research coming out.
Well, the World Health Organization is actually considering it a carcinogen, and that's indisputable, from the World Health Organization point of view.
Yes. So going back to the conference, when did it actually start? What was the first? How long has it been
We've been
running?
doing our annual updates in environmental medicine for 5 years.
5 years? Okay.
So every year for the last 5 years.
Okay. So doctors are attending this conference. What types of people are participating here?
We have clinicians and medical providers from all walks of life, from both standard medicine, so MDs, to what you would consider alternative or complementary or integrative medicine, so naturopathic physicians. We have acupuncturists. Some of my doctoral students in acupuncture are coming. They're very interested in environmental medicine. Nurses, physician's assistants.
So allopathic doctors.
Correct.
I'm really excited about this because about a month and a half ago, don't quote me on the timeline, I was at the Scripps Nutritional Supplement Conference and doing, interviewing a bunch of people. And it was exciting for me to hear doctors that were educated and raised in the allopathic medical system that have been prescribing pills for so many years realize that it ain't about the pills. It's about prevention.
Right.
And they want to learn the tools and get the tools and the research to help them go back and work and create better programs for their patients.
Right. I think we need to look no further than the last few months or the last 2 years in the United States, looking at what's happening at Porter Ranch in Los Angeles, right down the street from us. South Portland, we're going to have some physicians from South Portland. There's a kind of an emergency happening in terms of environmental contamination that was just discovered in Portland. My hometown of Durango, Colorado, there isn't almost anybody in the United States alive, unless they've been living in a closet, who doesn't know about the Gold King mine spill that happened in August. So that's still a huge issue where I live. It just has kind of passed through the news cycle.
And now the water.
Yes,
Let's
Flint,
talk about
Michigan.
Flint,
Michigan.
That's just the tip of the iceberg.
So the important thing to know about Flint, Michigan is that it is only one example of an entire country in which infrastructure has caused high levels of lead, in the drinking water. In Galveston County, after Hurricane Ike, 20% of the children had high blood levels, 1 out of 5. Nobody knows about that, but that's documented by the health department in Galveston County. So this is happening all over our country because of our infrastructure and the difficulty we're having chlorinating, trying to decontaminate our water supply.
And chloramines are now adding to the water.
That was the problem in Washington, D.C., where Flint, Michigan, this exact same thing happened in Flint, Michigan in 2004. for in Washington, D.C. We just have a short attention span in the United States. Short memory.
I know. I find it amazing that here in California they are doing forced vaccinations on children, yet the water in most of the state is toxic.
Well, I think that what is happening on a global level, and I would include China and India in this because of their issues with air,
yes,
not being able to breathe the air, is that all the citizens of the world are realizing that we have to do something on a global scale to access clean food, which is what we're talking about at this public forum on Sunday, clean air and clean water and clean housing. We have a serious problem with our housing. We have a lot of water damaged buildings. We're also going to talk about that at EHS.
Actually, I just posted a video on my personal timeline on Facebook. A town in, I think it's Alberta, Canada, completely eliminated homelessness. They had almost 1,000 people living on the streets in their small town. I mean, it's not a very large town. I think the population is 60 to 70,000 people, but they completely eliminated homelessness.
Good for them. Salt Lake City is doing the same thing here in our country. They're leading the whole country in eliminating homelessness by giving people homes to live in. What a radical idea.
I know, but I think when it comes to political will, a lot of the problem is that people don't want to be seen giving anything away because the hard-working people are the ones that are ultimately paying for it, or they're working and, hey, where's the benefits for me? If I'm working, why don't I just quit working? But it's not that simple. And
the situation in Salt Lake City, if you've ever reported on that, is that the people who are giving homes start working.
Yes.
They become employed
because
they have a place to live. It's that simple.
It changes everything.
Yeah.
Also helps them get better. They also have to support the housing with programs for addiction and all of that as well, and mental
healthcare. Healthcare access.
Yeah, absolutely.
Yeah.
So the conference itself, getting back to the conference, and this is Lynn Patrick and Cheryl Gray. I just realized I didn't mention your names at the top, but they're on the screen. So through the miracles of technology, we've somehow added your names.
Thank goodness.
So we've got the doctors on the 4th, and the 4th and the 5th is your attendees.
And the morning of the 6th.
And the morning of the 6th. Then you have a public forum that people are more than welcome to be part of.
Right.
Correct.
And that's on Sunday?
So the public forum is on Sunday afternoon. Registration begins at 1 to 2 o'clock.
Okay.
And the public forum starts at 3 o'clock. And because we have such great presenters on the whole glyphosate and GMO issue, we thought we would extend that through the public. So get on the website and register. It's $15 to attend the public forum on Sunday.
Okay.
And that's environmentalhealthsymposium.com. And the public forum goes from 3 to 7. We'll have a book signing for the authors that are there. And it's going to be all about the glyphosate issue, the GMO issue, which is a big issue. I mean, we're
clean
looking
food
at
is a huge issue for physicians right now, because we're understanding the direct linkage between pesticides and our food supply. Glyphosate is an ingredient and one of the most commonly used pesticide in the world. And autoimmune disease, gut-related disease, neurological disease, and cancer. So, if we cannot, if we can't promise our patients or teach our patients how to access clean food, we can't practice medicine. It's really that simple.
Right.
And so this is, there's also, we're doing something that no medical conference has done before, which is to bring the public together with the doctors to really talk about this. So we will have an actual meetup between environmental medicine doctors and the public at the public forum to talk about these issues. So there will be a lot of conversation, a lot of good, productive conversation. And Moms Across America will be there, which is I think they're a global now resource for parents in terms of advocating for GMO labeling.
Right.
Jeffrey Smith will be there with Institute of Responsible Technology. We'll have Tom Maltaire, who is a nutritionist and author, and Stephanie Seneff. She's a PhD, and Professor Giles-Eric Seralini, who that's, he's, to have him there to present in person is really a treat.
Well, I think that's great, and for our viewers and readers that are not in San Diego and won't be able to make the conference, just to know that we will have all the interviews available, so you will get to see.
Yes, it's all being professionally videotaped
as well.
Yes, and will be available we'll spread it all over the world.
Because this is not information that needs to be contained. It does need to be out there.
Yes.
And people do need to know what is going on and how to deal with these issues.
Okay. Well, ladies, that was perfect.
Great.
Thank you very much for your time.
You're so welcome.
I have to get back to the studio to edit this and get it. I don't have to edit it. You were perfect. So I could just post this.
Yeah, just post it.
I'll just post it and
That'll be good.
We'll promote the conference.
That'll be good.
Lynn Patrick and Cheryl Gray, thank you very much for your time, ladies. And we look forward to talking with Professor Seralini and Professor Seneff, and another visit with Jeffrey, which we just posted an hour-long interview yesterday.
Oh, good.
With Jeffrey.
Great.
And it was excellent.
Great.
I was able to get time with him. So
Great.
do what you can, people. It starts with you.